welcome to SCAN, a show brought to you by SCAN, the Social Community Activities Network. SCAN is a nonprofit agency dedicated to helping active adults stay informed, empowered, and inspired. I'm your host, Tracy Wolfman, and I am the CEO and owner of We Care Adult Care. I am also a board member here at SCAN, and I am very happy to have my guest here today, Dr. Cooperman. Welcome to the show today.
Thank you very much.
I just want to give all of our viewers a little background on Dr. Cooper, who we're very fortunate to have here today. Dr. Cooperman is a graduate of the Sophie Davis School of Biomedical Education at the City College of New York and the State University of New York at Stony Brook School of Medicine. He completed his internship at St. Vincent's Medical Center in Bridgeport, Connecticut, and an affiliate of the Yale University School of Medicine and New York Medical College. He then completed his residency in physical medicine and rehabilitation at JFK Johnson Rehabilitation Institute. He has been the medical director of HealthSouth Rehabilitation Hospital of Tinton Falls since 2005. He's also the section chief of the Department of Physical Medicine and Rehabilitation at Monmouth Medical Center, and is a clinical assistant professor of medicine in the Department of Medicine at Drexel University College of Medicine. He received the 2007 HealthSouth Medical Leadership Award and the 2011 HealthSouth Medical Director of the Year Award. He has been selected as a 2012 New Jersey Monthly Jersey Top Choice Doctor. And he is also, Dr. Cooperman, in an independent practice, which is affiliated and located at HealthSouth Rehab in Tinton Falls. So welcome to the set today. We are so happy to have you here.
Thank you for having me.
And this elaborate education and rehab medicine and internships and residencies. So you've been doing this for quite some time.
Quite some time, over 20 years.
Wow.
Yeah, it seems like it was yesterday, but it's been over 20 years.
You know what, it flies, right? When you're getting finished with all that, thinking, how am I ever going to start a practice after doing all this, right?
So true, so true.
So what we're going to talk about today, Dr. Cooperman is a physiatrist. And I hope that our readers and viewers today will see and get an education on exactly what a physiatrist is, because I think it's an unknown kind of practice of medicine.
I agree, and I appreciate the opportunity to educate the public about it, so thank you.
Thank you. So tell us, what is a physiatrist first?
So a physiatrist is a physician who is board certified and specializes in physical medicine and rehabilitation.
Okay.
So in order to become a physiatrist, you complete medical school, you do 1 year, at least 1 year of training after medical school in an internship, whether it's surgery or a rotating internship, such as a transitional year or a year of internal medicine. And then that's followed by 3 years of specialized training in physical medicine and rehabilitation. And that's the core of it.
So you go to medical school, you do your residency, and then you do an additional residency in physical rehab medicine.
So it's a total of a
Wow.
minimum of at least 4 years. You have 1 year of internship and 3 years of residency training before you can complete your rehabilitation medicine training.
So a specialty with a residency and teaching as long as any other specialty.
Yes, very much so.
But let's tell our viewers in a little bit of layman terms. So most of our viewers are the active senior,
Okay.
right? So they're trying to stay active, and we know today everyone has ailments and pain.
Right.
So we're making an appointment to come see the physiatrist, and what are you going to do for our viewers? That's what we're going to share, right?
That is an excellent question. So a physiatrist, if someone asks me what a physiatrist does, what our main goal is, our goal is to keep our patients active and functioning in the community and enjoying living their lives on a daily basis, and really making sure they can continue to contribute both to society and also have a sense of self-worth for themselves as well. The main takeaway, I think, is function. It's all about function. We
yes.
want to keep our population, our patients, functional and maximize their level of functional independence so they can really have a sense of thriving in their lives.
With their ailments.
With their ailments, right.
Or you're going to fix them.
Correct. So we see patients with very many different types of diagnoses, from arthritis all the way to traumatic brain injury and spinal cord injury. So our goal is to help patients recover neurologically and continue to improve their strength and ability to function,
right,
but also to function within the community, with the scope of their impairments and disabilities, not letting those be barriers to them living a full life.
A full and active life. So somebody is going to, and what I'm trying to express to our viewers here is that the benefit, so a physiatrist, somebody's going to get physical therapy, say, whether we're talking outpatient, and we'll get to inpatient and outpatient in a minute. But instead of just getting that prescription for physical therapy, to have an evaluation by a physiatrist first to implement that care plan is what I'm trying to
correct.
Give our viewers the information on that. So I guess what kind of assessment is done by a physiatrist versus just getting a prescription for physical therapy and going for that?
So you're so right, because physical therapy, you can get a prescription from a physician that says physical therapy and then go to a physical therapist.
Correct.
But I liken that to getting a prescription that just says antibiotic. You wouldn't get a prescription that says antibiotic and then go to the pharmacy and let the pharmacy decide which antibiotic is appropriate for the patient. Not to take anything away from, not at all to take anything away from pharmacists,
right,
but there is a certain amount of training behind the medical training that physicians go through to determine which antibiotic is appropriate. And the same can be said for rehabilitation. So with physical therapy, when a patient is assessed by a physiatrist, the patient is evaluated and a very specific plan of care regarding therapies, physical, occupational, speech therapy, is spelled out very specifically with certain precautions and goals, and then the rehabilitation doctor is kept abreast by the therapists how the patient is doing, and if adjustments need to be made during the rehabilitation progress course, we can then adjust to help patients continue to meet their goals.
So it's just an added benefit and a professional evaluation that coincides with the physical therapy, and probably a lot of people don't realize that they can have that benefit.
I totally agree that that's true. Many people don't even know what a physiatrist is.
Right. So hopefully our viewers today will now know what a physiatrist is, the benefits of using one, and how you can get in contact with one. I'm going to ask Dr. Cooperman right now to explain to us a little bit about the difference of inpatient rehab and outpatient rehab and how HealthSouth assists people to accommodate their goals.
Thank you. So patients can receive therapy and rehabilitation in various settings. They can receive it either in home through home care therapies. They can go to an outpatient facility a few days a week and for an hour session usually get therapy. Or if their needs are more extensive and they need a more intensive rehabilitation program, that's where inpatient rehabilitation comes in. And very often inpatient rehabilitation plays a role for patients who have been in the hospital for an acute medical or surgical illness, and then they're medically or surgically stabilized, but during the hospitalization, they may have lost muscle mass, there may have been other functional issues which went on, so while they're medically stable to go home, they're not quite able to go home functionally, or very often they have ongoing medical issues which can be managed in a rehabilitation inpatient setting while they're concurrently receiving therapies.
Right, so they can be observed, monitored. I mean, I think it's wonderful that HealthSouth provides that extra service with the physiatrist on hand, because a lot of the physical therapists that I've worked with over the years have been complete assets to that team of caregivers.
Yes, I agree.
I mean, they're amazing.
I think the key word that you just said right there is team.
Right.
Rehabilitation medicine is all about teamwork. It's a very interdisciplinary field of medicine where the rehabilitation physician, the physiatrist, works in concert with all of the therapists, physical, occupational, and speech therapists, and nurses, and other specialists, other physicians, to work as a team to help the patients reach their goals.
Right, and have that comprehensive plan.
Right.
Tell us a little bit briefly about, for some of our viewers that may not know, HealthSouth is truly a specialty hospital.
Correct. HealthSouth
and
is
rehab.
Yes.
So you tell us, Dr.
Okay.
Cooperman.
Thank you. So HealthSouth Rehabilitation Hospital of Tinton Falls is exactly that. It's a specialty hospital. It is a hospital level of care. So patients who are admitted receive hospital level of care for their medical needs and for their nurses' needs, in addition to receiving 3 hours of therapy daily to help meet their functional needs.
3 hours daily. That is a key word right there, because I always tell people, make sure you're going to get therapy 7 days a week, not 5 days a week. And usually it's a half an hour to an hour, and now you're saying they get 3 hours. That's a big improvement.
Right.
So for those of you that want to have aggressive therapy post-surgical, or just an evaluation, I think HealthSouth would be a great choice to start off at and have your therapy.
I totally agree. And patients who come to HealthSouth, as you know, in the field of medicine, the way healthcare is today, patients are moved along the spectrum rather quickly. So sometimes patients are discharged nowadays a little bit more quickly than they may have been discharged 10 years ago even.
Much more quickly in the healthcare field, we say.
Exactly. So patients often have ongoing medical needs which are addressed, and there are some very specific differences between the level of care that an acute inpatient rehabilitation hospital like HealthSouth can provide versus some other types of settings as well.
And briefly tell us about how your outpatient therapy department works. So we went through the inpatient therapy, and now after they're discharged, they could typically come back and continue services with you and still have the benefit of being seen by the physiatrist as the leader of that team.
Correct, right. So we're very fortunate in that our HealthSouth Rehab Hospital here in Tinton Falls has a very vibrant outpatient therapy program. Patients can continue to receive aggressive physical, occupational, and speech therapy.
Wonderful.
And very often there's continuity of care because the patients who were in the inpatient side now seamlessly progress to the outpatient side. So it's not starting anew, it's a real continuity of care because we're all part of the same team.
Wonderful. I hope our viewers have an understanding of what a physiatrist is, the difference between inpatient therapy and outpatient therapy, what HealthSouth has to offer, and we're going to come back with Dr. Cooperman after a break to learn about some of his other techniques for helping people in the community and in their hospital to assist them with having a healthier, more productive, functional way of life without necessarily having to go through medication routes and I guess be at a disadvantage when they're healing.
Very well said.
We're going to take a quick break here on Welcome to Scan, but we're going to return with some more important information for our viewers after these messages, and Dr. Cooperman will be back to give us another education. Thank you.
So, if you're over 65, like me,
and active and fairly healthy,
being active and healthy alone will not protect you.
Remember, the immune system weakens with age.
And if you're over 65, ask your doctor about your vaccination options.
we want you to be healthy and active.
Welcome back to our Welcome to Scan show. I am your host, Tracy Wolfman, the CEO, owner of We Care Adult Care, and I am having a great conversation here with Dr. Cooperman from HealthSouth. So thank you again for being on the show today.
Thank you.
And I just want to do a quick recap of one statement of what is a physiatrist for our audience so they know the difference between a physiatrist and other interpretations of a physiatrist.
Thank you. So a physiatrist is a physician who specializes in physical medicine and rehabilitation. Very often people may get confused with physiatrists with other medical specialties such as podiatrist or psychiatrist.
Right.
In some parts of the country, people actually pronounce physiatrist as physiatrist.
Oh.
So I often say rehabilitation medicine when I speak to patients, but that can be confusing too because people don't quite know what that means. But
Right.
I think that you allowing us to educate the public about this is a great service because patients can really now, whether they're home or even in a hospital like Monmouth Medical Center, can seek a
Right.
physiatry consultation.
So, Dr. Cooperman, thank you so much for interpreting the physiatry term.
Thank you.
So we want the public to understand what that is. So now that we've reviewed that and we all have a basic ground knowledge right now, you do something that's called mindful meditation.
Correct.
So tell us and our viewers a little bit about what mindful meditation is.
Sure, thank you. So mindfulness and meditation are really not a new concept. It actually goes back hundreds, maybe thousands of years.
Wow.
But it's now beginning to really pick up speed in everyday culture and even in everyday healthcare as well too. So mindfulness is all about paying attention to what's going on in the present moment.
Correct.
And in our very busy, overstimulated world, it's very easy to get distracted and to get your attention drawn in multiple directions. And sometimes it's good to really learn a skill to help us really take deep breaths and enjoy what's going on and pay attention to what's going on.
I think it would be important for everybody, whether they have an ailment or not, to do that because it's a hectic life we lead today.
Yes, it's a very overstimulated life, as I said,
yes.
And it is very hectic. And meditation is one way of helping us hone our skills of mindfulness by meditating and learning to pay attention, say, to our breath. It helps us focus our attention. It helps us really grow our part of our brain that focuses on attention, that works on more of the rest and digest mode as opposed to the fight or flight mode.
Okay.
And that helps us respond instead of reacting to crises and times of stress. And that's helpful, as you said, not just for patients,
Right.
but for all of us.
All of us on it every day. So you're using this mindful meditation in your therapy program to try and get people rewired, rethinking. Is that
correct? So I try to introduce it to patients when I feel that it may be a beneficial modality for them. Nothing is appropriate for every person, but what I find most interesting about mindfulness and rehabilitation medicine is that they share a common denominator. That being,
it seems to be on the same path.
It does. Neuroplasticity. It's another word that many people may not have heard of, but it's a buzzword that you may hear from time to time.
Neuroplasticity. I'm trying to think if that's ever been in any of the lectures that we hear on therapy.
So it's what neuroplasticity is. We used to think back 20, 30 years ago that once we reach adult age, our central nervous system stops developing and maturing and really can't make major changes.
That's scary.
But now we know that that's not true. We
Okay.
learned that the nervous system and the brain can continue to make changes and adapt to changes in its environment throughout our lifespan, and that's neuroplasticity. And meditation is based in the foundation, especially mindfulness meditation,
Right.
based on the foundation of neuroplasticity. And much of what we do in rehabilitation medicine, using evidence-based treatments and therapies to help our patients recover, is also based in neuroplasticity. So there's a very nice overlap. And very often, if I have a patient who may be having a hard time dealing with anxieties or depression related to disability injury,
because it's a hard phase that somebody's going through. It's very difficult for them to be an active person and then all of a sudden they're incapacitated with a disability. And the thought process is, I can see where this would be very helpful.
yes, it's life-changing, not just for the patient, but for the family. So if there's a way, like you said, to have somewhat of a cognizance of what's going on with your
Right.
thought process, it can help promote both emotional healing as well as physical healing.
So when you think about it and you try and approach people that are in your facility at HealthSouth with this new, well, it's not a new technique, it's in addition to the other therapies that you're doing, that you're implementing this. I'm sure there's some resistance at times from people that they think, I can't do this.
That is very much true. Very often patients scoff when they hear me talk about meditation.
Right.
But meditation is not pertaining to any particular religion, although it can be found in multiple religions. I explain it as a secular scientific method which can help patients continue with their recovery. And the one thing I stress to my patients is that any amount of meditation or mindfulness is helpful. It doesn't have to be prolonged, and there's no such thing as a failed attempt at mindfulness or meditation. So whatever you try to do, you're going to reap benefits from, even if you're not aware of it.
So something you just said resonates with me. You're not going to have any failures with the meditation or the neuroplasticity, right?
Right.
So when we think about people in recovery, you know, it's a struggle every day. So if that's going to be the positive and you're not going to have any failures, I mean, that's really forward thinking for the client or the patient, whatever you call them in there, to have that ability to say, I'm doing something that's making me move forward with my rehab.
That's very well said, and it's really true, because we know now that the human body, the human brain, the nervous system has the ability to continue to recover. So we want to have our patients understand that, instill that hope in them, and know that there is hope for the future.
Right. And so you collaborate with the whole team. You implement the mindful meditation, the neuroplasty. Now, I want to ask you, what does rehabilitation medicine and mindful meditation in combination, are you the only one doing that?
It's a very good question. I do know of many studies going on out there that have shown benefits for, say, patients who have had strokes or traumatic brain injury when they entered a course of mindfulness meditation, how it has actually shown significant benefits. So what I look forward to is a future when I can continue to expand that and bring that to more of our patients.
Yeah, that would be wonderful, because, I mean, any kind of alternative treatments where you're not using medication to recover is a big benefit, especially today. So you have that whole healing process going on with the mindful meditation. And is that separate from their physical rehabilitation, or do you do it in collaboration at the same time they're having therapy?
So it could be done either or.
Okay.
I instruct the patients in techniques that they can do themselves when they're in their room. We have social workers and neuropsychologists who also can help educate patients and go over the techniques with them. And many of our therapists are trained in these techniques too.
Okay.
So they can actually, say, incorporate a technique such as taking slow, deep breaths while they're doing therapy.
Right.
While they may be anxious that they can't do a certain task, if they learn to pace themselves, take deep breaths, it really is a way of incorporating that mindfulness into their rehabilitation therapies.
Right, right, right. You've been at HealthSouth now. All of this, now that we have told all our viewers about the physiatrist and the benefits, do you give lectures out in the community or at HealthSouth that the public can come and listen to you speak about the recovery process?
I do. I have given talks to various groups, to the public, to certain specific patient support groups. I've given lectures at various locations. So one of my goals is to help bring this message to the general public.
To the general public. So do you have a calendar of events on the HealthSouth website, or how can our viewers learn about what you're speaking about?
So when we do schedule events that we open up to the public, which is quite often, we have a very involved marketing program in our hospital that's very enmeshed into the community, and we make sure that we get that information disseminated as widely as possible. So we make sure that if people want to come, it's available for them to
Okay.
retrieve that information.
So we should all look at HealthSouth's website to see what upcoming educational seminars Dr. Cooperman will be sharing.
That would be great.
So anything else you want to tell us about HealthSouth? Because I have one story I want to share, if you don't mind.
I'd love to hear.
So I got to go to I guess it was the 10-year anniversary of
Yes.
HealthSouth's opening. And I was so moved by this gentleman who came up in a wheelchair. Were you there?
Yes.
Okay. And he spoke, and just his journey to get there, and I'm thinking, oh, this poor guy, it's so great that they taught him how to live in a wheelchair, because that's what the previous rehab center told him, that we're not going to get you better, we're just going to teach you how to live in a wheelchair, which for people, that's a positive thing. Let me learn how to live a life like this.
Absolutely.
And then when he got out of that wheelchair and ran down the walkway of the whole presentation, and he really alluded his recovery to all of you.
Wow.
And it was just, I think it was the first time I've ever seen such a recovery. You know, and it was like the wonderful things you do at HealthSouth.
Wow, thank you. It's moments like that energize me to get up every day, and for all of us at HealthSouth to get up every day and do what we do.
To do it.
Miracles happen every day, and we love being a part of it.
Right, and that's what you have to wish for.
Exactly.
Dr. Cooperman, I really appreciate you coming on our show today and educating our viewers with your information about what we do at HealthSouth and all the benefits that can be had. Thank you for being my guest.
Thank you very much for having me.
Thank you, viewers, for listening to Welcome to Scan, and we hope that you continue to listen to us and call us with any ideas that you may have for our show, because our job is to give you informative information. Thank you very much, and thank you, Dr. Cooperman.
Thank you.